Do you wish you had an app to help you find the best doctors at the best price? Are you a healthcare provider that needs an app to showcase your practice or doctor network? Now you do with Doc.go. Hi, I'm Fred Hanna, creator of Doc.go. Doc.go is an application that helps consumers find the best doctors at the best price. Want to hear more? Just stick around. The 10-minute VC pitch is about to start. Once upon a time, a man and woman in love had a baby. They moved in together, had the first baby, a little while later had a second, and then mommy and daddy got the bill. It was the same doctors, same procedures, same facility. So they wondered why the second one was almost twice as much as the first one, and it turns out, while mommy and daddy were busy between baby one and baby two, the hospital was busy renovating the maternity ward. Consequently, higher costs for patients. It's the same procedure. How do you know how much you'll be paying? We're not all in tune about what the facilities are doing to improve their facilities and passing on costs to us. How do we know how much we'll be paying? Just in New York, one facility has a mammogram for $130 and another for almost $2,000. Such a huge difference across the country in the same cities, the same procedures, have dramatically different prices. Doc.go is the application folks will be using to type in a medical service or treatment and search for doctors in the same area. It not only ranks doctors in the same area by cost, but also includes a quality indicator and includes doctors slightly outside the area. This guarantees savings in every search result. Like what Expedia and other platforms did for travel, where you can type in your destination and compare providers, compare hotels or travel amenities, Doc.go does for healthcare. A patient goes to a hospital and they charge them a certain amount. How do they know what other hospitals are charging? It's not as transparent. Doc.go knows the prices of all the facilities for any given procedure. The patient goes to Doc.go, types in that procedure, and we facilitate providing the best doctors at the best price. And the patient is never charged. We provide the cloud to the patient. We're bringing in the new revolution of cloud facilitated healthcare. So, a lot of people didn't used to care because many have and some still do have traditional healthcare insurance we all know, which I'll call the old way, where you go to the doctor, you pay a little, and insurance takes care of most of the rest. That's going away. These very popular plans called PPOs are being dropped across the country. Many of us will have the new way, an HSA, a mandatory health savings account, where we'll deposit some of our pre-tax income and use that to pay for the first several $1,000s of all medical expenses. Once you've paid $2,000 to $3,000 for an individual and $4,000 to $5,000, maybe up to $7,000 for a family, then insurance kicks in and starts helping to pay for any bills after that, called the deductible. And if you haven't saved up enough to meet your deductible, you're paying out of pocket for everything until you meet that amount. This created until now 20 million people in this situation, growing at 15% per year since 2011. We call them the new cost-sensitive healthcare consumer. They can also use their HSA funds to pay for things insurance doesn't even pay for, like assisted living, long-term care, acupuncture, glasses, LASIK if you don't want glasses anymore, weight loss services, which can prevent a lot of other issues, and a lot of other medical expenses. Folks will use Doc.go to type in a medical service or procedure and see the list of doctors ranked by quality and distance. Because of travel, a doctor that's twice the number of miles away may only be a few minutes away because that distance is spent on the highway. People only look at distance and don't consider time. How far they're away in time is also listed, so you know exactly how far they are. People are willing to travel, studies show, up to 21 minutes for better healthcare or more affordable healthcare or better healthcare. We look at it by distance, intuitively by distance, but we don't consider time, and this is one way we differentiate. If you don't like the doctor, swipe left, and it lists another, more comparable, affordable healthcare provider. We're able to guarantee savings because we combine patients with this new liquid cash funds in their HSA with doctors who would rather give a cash discount than incur the overhead of chasing non-payment and possibly sending to collections. Our biggest competitor has only 6,000 doctors in their networks and their platform, and about half of 1% of this HSA market. This is out-of-pocket spending is over a $416 billion industry. That's the amount in your HSA, plus any other out-of-pocket expenses you've paid after that across the country. Folks last year saved over $19 billion in their HSA at the beginning of the year. By the end of the year, they spent most, if not all of it, and then some more out of pocket. We help them make smarter choices and have transparency into where they're spending it, smarter choices on where they're spending it, so they can feel comfortable and confident that they provided the best possible health care at the best value for the whole family. And for that, we collect the 7% for the prepaid visit, totaling $1.34 billion. Now we're starting off smaller in Chicago and Illinois, so it's a much smaller area. That's the longer term vision. Immediately we're starting with dermatology and visits that are uncomplicated, colonoscopies, MRIs, things where you know you're scheduling a visit for a specific procedure and it's not likely to have a very different cost once you walk into the office. Very clear-cut, concrete visits. These plans will be much more popular with HSAs in the next 2 years. Here's what we'll be doing in that time to make us the most prepared company to meet the increasing demand of HSA patients. Our operational strategy and plan involves us helping consumers meet healthcare providers and facilitate a visit. On the consumer end, they're comparing physicians. On the practitioner or healthcare provider end, they are adjusting their prices and booking appointments and accepting the appointments. In between is a very talented, experienced team setting up the platform for the patient registration, the one-time simple registration, and the searchability and the databases and all that information that goes into finding that best physician at the best price. In 3 phases, we'll be implementing this. The first one is R&D. We need to collect claims data. We need to know exactly how much physicians are charging for very particular procedures. Not only how much they're charging, but how much they actually get to get paid. Sometimes they charge a certain amount, but only expect to receive a certain amount. If we cut to the chase and just charge the amount they expect to receive, the patient pays for that amount upfront, same day, and that provides savings to the patient, and it facilitates the physician's practice. The second phase will be continuing to develop the platform and expanding it. Like I said, we're starting off in Illinois and Chicago, which has the greatest number of HSA users. So it'll be the perfect place to launch this. After launching, we're expanding operations into other markets. So our financial plan will involve $1 million upfront. $250,000 will be provided by us. We're bootstrapping the investors. Just to show we're committed to this, we have already started in January building the platform and compiling all of the claims data. We will be in the red for that first year for the $750,000 investment. And in the second year is when we break even. After 2 years, after that 8 quarters, we break even. Revenues start occurring in the second year. And then we'll continue expanding. And our marketing and promotion plan includes also 3 phases of creating awareness, promotions and ads, and increasing the reach. So these HSA patients also happen to spend in certain ways, in certain patterns. There are HSA groups on Facebook. We can have advertisements where they normally go, which is certain doctors that have already converted their practices into cash-only practices. We include testimonials from physicians who have had their practices improve dramatically from converting to cash-only practices. They accept HSA funds, and medicine is a profession where there's a lot of latitude. Doctors only change when they see other doctors changing. Testimonials from these physicians and these healthcare providers that their practices have improved dramatically after converting to cash only or starting to accept cash or giving discounts for cash will convince other physicians of doing the same. Our funding is a traditional C Corp structure. A total investment $750,000, and like I said earlier, $250,000 will be from us, the investors. 100,000 shares will be distributed, $50 each. And the founders have a 90% stake, 10% for the investors, which is 10,000 shares of the 100,000. Exit strategies, of course, we consider. We're not planning on an exit immediately, but we like to, in advance, optimize for the best for every possible scenario. So if we're optimizing for the best case scenario, an IPO, a buyback after the initial 3 years, or selling to a friendly buyer. Selling to a friendly buyer might be a challenge because nobody else that's that big is in this industry. So we likely wouldn't be bought out. Insurance companies are doing a very similar thing, but they're competing with each other, so their angle is not to provide this much transparency. We're open to working with the investors. We trust that venture capitalists in this industry have much experience. We look forward to hearing from them, to hearing what we think. We're running the company ourselves, but we are all ears in terms of any kind of coaching or directions or recommendations investors will have. We have a flat organizational structure, or myself, the CEO, and our Chief Marketing Officer, and our Chief Technology / COO operations, which is an internal role, marketing, which is external, and the CEO, which is responsible for the relationships and overall direction of the company. So, rising variable healthcare costs across the country. Very different prices for the same procedures across town in the same towns. Nobody knows the prices. We're also put in a situation where we don't know how to shop. Not only is there no platform, we don't know how to compare it. Not only do we rank doctors by price, we also include a unique quality metric, including things people don't think about till later. If you go to a doctor and don't see them because there's always another person there. So these are important things that factor into the quality of a physician. It empowers you. So join the oncoming healthcare revolution. Thank you.